highly educated, successful executive, no different than their clients and their pharma companies. In light of all this and everything else, how does it go wrong? How does it happen?
Well, there's a behavioral component to this in terms of what people are thinking about, how they're indexing performance, incentives, compensation on the front lines of business. But maybe we can talk about a few of the red flags that might be missed, okay, in terms of how a risk-based compliance program can miss risk. And I think Tracy Price said it well when she was talking about how if you think you're in a low-integrity, high-risk region, beware of thinking that a distribution or intermediary model is going to move you away from risk. I think that's the enforcement speak for be careful about changing seats in the Titanic, right? Mm-hmm. So here it is. We're all thinking about third-party risk, what kind of risk they present to your companies, how to mitigate it, how to assess it. But not all third parties share our concerns. And in my 15 years traveling all over the world, you know, I spent an average of 250 days a year overseas for over a decade. I heard a lot of third-party attitudes about the FCPA, the Bribery Act. Those are just Western standards being imposed in our country where they don't belong. Or it's legal here, it's tolerated here. So we're not even a party, you know, as a third party to this law. Oh, but you want me to sign paperwork that I will respect the law, that I will adhere to it, to get partnership and representation from the major companies that are here today? They are happy to sign that paperwork because they don't take it seriously. So I would caution you to think that an intermediary, a distributor, signing anti-bribery paperwork as a standalone sign that they embrace anti-bribery laws can be a little bit misleading. It's one thing to have that sort of paperwork and representations at the end of a robust due diligence process, but to think that standalone, them signing that paperwork means that they do respect the law, I'd be cautious about that because they need your companies. That's how they make money, or through being your distributor or your intermediary. And I think the other piece of risk that's missed is almost the opposite of what we were talking about yesterday in the compliance roundtable. We have data analytics on one hand, and there's a robust discussion around that. But I think the opposite of data analytics is maybe the greatest compliance asset that you have is your instinct, right? Your gut and how you might look at a particular transaction or third party. So allow me to tell a short war story.
Sure.
Right? I receive an order, and this is a little bit of a defense story, but I still think it's representative, of $1 million of grenades for a small Caribbean island of Antigua, which other than some rowdy tourists has no external or internal threat, right? The order comes in at full price where a discount would have been granted if they asked for it. And that order sails through audit and compliance. It's at full price. It's completely financed. It's even licensed by the State Department. And of course, when that order gets brought to me, I'm not thinking, wow, that small Caribbean island could probably use a hospital or a school. I mean, I'm ethically numb to my decisions, right? I'm looking at the win-win of business. So from a compliance or audit perspective, there was nothing wrong with that order, with one exception. Everything was wrong with that order. It was for a product that the country didn't need in quantities that were certainly disproportionate to even a small requirement at pricing that didn't make sense to the market. So the atmospherics of that order were all wrong, even from a data perspective if there was nothing wrong with it. So I ask compliance executives and leaders, do you ever just hit the pause button and say, we need a little bit more information about this, because to us, just looking at it, we don't think it makes sense. And I think that is a underutilized but a wonderful resource, which is like good parents. You get to say no just because you're allowed to and ask for explanations. So I think that, taking a look at that type of risk holistically might make a lot of sense. So those are just a few.
I mean, the folks out here have policies, controls, 100-page manuals on charitable contributions, on speaker programs, on everything. There is no stone unturned from a control environment perspective. How do they keep it from going off the rails, especially when you take into account folks being overseas and local cultural considerations? What more can they do?
So I think pivoting to something that Michael Shaw said yesterday, show your vulnerability, your humanity, in the respect that what Gary just referred to as this robust set of policies, rules, and procedures might not look so simple far away from home in low-integrity regions where a remote office might be a hotel room for that night, and where people are working towards what their supervisor are calling them about. How are your numbers rolling up? What does the quarter look like? Right? That's what they're thinking about. That's sort of the message. I mean, tone at the top is represented by anyone's supervisor at the front lines of international business. And a lot of great compliance programs go wrong when the voice of get the business done starts to drown out the voice of we care how you get the business done. And I think when compliance leaders share with their frontline teams, look, it's simple to us, we're good with this, but we know it can be confusing where you work. And no one understands risk better than the people that work in the middle of it. So guess what? If we're missing something, if we're not clear about the importance of how you get the business done and helping you with that, guess what? Talk to us. And by the way, if we're upset with what you share with us, and we might be, that conversation's going great because we can fix what we know. And when people at the front lines of business start to embrace compliance not as the recipient of compliance, but when they think of themselves as compliance ambassadors, and they look at the compliance department, not like I did. I mean, now they're my friends and my colleagues. Back then, you were all the bonus prevention department, okay? But when they say, you know what, these people actually want me successful, but you know what? They want me safe and they want me back home. So I know that if I'm jammed up, jet lagged, sleep deprived at the end of a quarter, and I'm struggling with something, I can call home, get that monkey off my back, and we can share that decision to do the right thing. So when your commercial workforce think of themselves as compliance deputies, compliance ambassadors, particularly your sort of regional level management, then when that robust set of policies, rules, and procedures starts to look a little bit confusing, far away from home, they know that the best thing that they can do is to share a decision with someone that they feel will embrace a struggle and not reject it.
So a lot of these programs have evolved. The messaging, even from within the business, has evolved. I think it's more clear than it's been in a lot of cases. The control environments, et cetera, et cetera. Maybe you could touch on, though, as companies make a lot of different moves that are becoming more clear, one of the things that's less clear, and we've seen KPIs and other things work their way from compliance onto the business side. Some companies taking a hard look at incentive compensation, completely overhauling it and disassociating it from sales, others trying to get a better blend. How much does that the incentive comp factor, and overall market, budget forecast play into your equation, your thinking out there, no matter what the program and communication looks like?
So incentives is becoming front page topic with what just recently and what's happening now with Wells Fargo. So here's, I think, a reasonable analogy is about 3 weeks ago, I was prescribed some prescription medicine from my physician. Thank God, nothing serious. And I made the mistake of going online to look at the side effects. And about halfway through is when I hit the 911 to my doctor, and like, is this cyanide or is this just, is this to help me? And he's like, let me worry about that, get back to work. So your incentive systems should have the same warnings, because every incentive system has an unintended side effect, like prescription medicine. And good performance can be a cover for bad behavior. And the problem is that a bad incentive system can remain invisible until it's too late. I mean, Wells Fargo designed a reasonable incentive system to grow their business. In the defense business, cross-selling is a part of life. I mean, that's nothing new. But it went wrong. So if people in your commercial workforce think of making money, success, and performance as running counter to compliance, that compliance and success are a zero-sum game, that's a problem. And Michael Shaw yesterday talked about how GSK...
Shaw pay you for all this airtime?
He doesn't, and I'm not a promotion. Yeah. But it's really, I appreciate his comment that they went ahead and re-engineered their incentive system so that everything was pointing in the right direction. And I think their chief medical officer, I was reading an article where he said, you know what, sometimes you have to roll your business plans backwards to roll ethics and compliance forward. Mm-hmm. So I know that incentives can be controversial, like why should we have to pay people to do the right thing? And if we have an ethical workforce, no incentive system is going to tip them in the wrong direction. I think it's more complex than that. And a lot of large multinationals where you have a matrixed organization, HR is in a silo, compliance is in a silo, but I think if you don't have a seat at the table where strategy is being discussed, where aggressive rollout of forecasts are being analyzed in your planning process, because this doesn't happen overnight, and you don't have a voice in how that looks and how it gets rolled out, absent that seat at the incentive and the strategy table with human resource there as well, I think you're left to catch falling knives afterwards. So having a voice in projections, incentives, really helps you downstream.
Last question before we get back to Ren. Frequently, what we hear from the business folks is the other guys are doing it. So how does that conversation get processed by the business out there as they're looking around from the generics to maybe some of the other multinational competitors? They're engaging in the very same behaviors compliance is asking you to refrain from. They're making the sales, you're not. How do you process that? How do you work with compliance?
Well, first, don't discount it, because pharmaceutical, life science, medical devices, you have trade shows just like we have in defense, and people are meeting up, they're talking, and they're exchanging war stories, believe me. And they're talking about who's dirty, who's clean, how you get the deal done. There's a real exchange there that I think has a profound effect of, if I don't do this, someone else will. Mm-hmm. So understanding that impact of local cultures is very important, and I think that goes back to that planning process, is that forecasts and quotas and projections don't happen overnight. And when people feel empowered to talk about corruption risk or kickback risk, while that planning happens, that's when they get to say, look, this is a tough market. My competitors aren't playing the way we play, so we need to bake that risk into my regional or local strategy. And when people, I think, feel empowered to raise that voice instead of being intimidated, because usually those forecasts roll downhill, then you're baking risk into your business strategy. And that's on a very personal basis.